Hi guys, it's Dr. McJunkin. Sorry for the slight delay here. I was having a little bit of technical issues. But today we are going to talk about urgency. Um, I hope you guys were able to watch the last visit that we did where I interviewed a doctor who specializes in pelvic physical therapy. So I thought that was really interesting and I felt like I learned a lot. But today we're going to talk about urgency. Urgency is the hallmark of overactive bladder. And so, overactive bladder. So, we're going to talk about a few things. What is urgency? Why do we get it? What can be done? And so, we'll just start with that. What is urgency? And so, urgency really, the definition is very simple, but it's an abrupt, strong, overwhelming need to urinate. And so that's called urinary urgency. And you could also just think of it as if you're rushing to the bathroom, that is urgency. Oftentimes it's associated with incontinence. I feel like you're rushing to the bathroom, oops, couldn't quite make it, and that's incontinence. And so one of the big questions is, well, why do we get urgency? And so it's actually a complicated answer, but we'll kind of talk about that today. Um, and so, generally, when someone says that they have the symptom of urgency, we're thinking about a few different things. So, number one, we're thinking, do they have the condition called overactive bladder? And you guys are very familiar with what that is, but essentially, that is where you have a strong urgency. Oftentimes, you'll have frequency where you're going throughout the day very frequently, over 8 times a day or 8 times in a 24-hour period. Oftentimes, people have nocturia where they're waking up more than once per night to go to the bathroom, and then you can also have incontinence. So, that kind of cluster of symptoms, you don't have to have all of those, but we call that overactive bladder. So, the hallmark of overactive bladder is this thing that we call urgency. But that's not the only thing that can cause urgency, and many of you guys could probably attest to this. If you have an infection like a UTI, that can give you a lot of those same things where you have a strong urgency, maybe you're going frequently. For men, an enlarged prostate can give you a lot of those same things where you're, wanting to go frequently at night, having the strong desire, maybe not fully emptying your bladder. There are some other types of infections, so urinary tract infection, obviously one of them, but you can have some other types of infections like prostatitis that can give you those symptoms of urgency as well. There's some other kinds of bladder problems, and then there are things like neurological diseases. So, multiple sclerosis, ALS, Parkinson's, all of those things can affect the peripheral nerves and even the central nervous system, giving you this sensation of urgency. We also know that the nerves themselves can be damaged from things like diabetes or just even things like prediabetes, where long-term exposure to sugar can damage those nerves. Abdominal pressure. So the classic example is a pregnant lady, has the strong desire, and oftentimes will have a little bit of leakage, and that's because the baby is making so much pressure within the belly there. But if we're overweight, that can also put pressure on the bladder and the pelvic floor muscles as well. One of the very interesting things, I think, is there are a lot of medications that can give you this sensation of urgency. And so I'd like to review those because I think, doctors are very quick to prescribe medicines, but oftentimes we don't discuss the side effects and the risk. And all medicines generally have side effects and risks. So it's important for us to understand that many medicines can cause these same kind of cluster of symptoms, specifically urgency. And so let's talk about those. I'd say the most common one that I see, and one that's a problem for people who also have the bladder problem, is diuretics. So diuretics are given oftentimes for high blood pressure, and so people will call those water pills. But those obviously make you go to the bathroom more, and oftentimes it's a strong urge that's associated with them. Lithium is another medicine that's used for bipolar or depression and some other conditions. a lot of the antidepressants fall under this category where they can actually give you some urgency. So the SSRIs or the serotonin reuptake inhibitor medicines. So those are medicines like Prozac, Zoloft. Those medicines can give you the same urgency. Some of the other kinds of antidepressant medicines are a little bit older class, or tricyclic antidepressants. And so those are like imipramine, but those can also give you the same kind of thing. Antihistamines, so that would be like Benadryl, and there's a few other antihistamine types of medications, so for allergies. Those can give you urgency. Calcium channel blockers, so those are medicines that are used for high blood pressure. Those can also give it to you. Alpha blockers, which are oftentimes used for blood pressure, or men sometimes with prostate issues. Clonidine, which is another blood pressure medicine, and benzodiazepines, or anxiety kinds of medicines. All of those medicines, so it's a huge group of medicines, can also give you urgency. And so what we try and do is try and tease out, is it just a medicine, or is it really an underlying bladder issue? Things that aren't prescriptions, but certainly people are can be very irritated by things like caffeine, and also things like alcohol. And so those are strong irritants for a lot of people. Spicy foods can also be another one. And so for some people, those will give them a real sense of urgency or even frequency. Okay, so why do we get it? So that is the question. In overactive bladder, we know that basically the underlying cause, the reason that we get this urgency, so the urgency comes from these little receptors, which are kind of like little proteins that are stretch receptors, and they let us know when the bladder is full. So that's where we get the sense to go. So we can have abnormalities in those proteins. We can have abnormalities in the peripheral nerves that go and feed into the bladder, and ultimately into those proteins, or even into the central level. So any of those things. So generally, the way that I think of urgency is, it's much more common as we age. It relates to what I would call oxidative stress, and that's how we experience all diseases in our body, generally, how we experience aging, and ultimately it affects these nerves, and then it also can affect the proteins and how well that they function. And so for some people, it might be that they're, have, the proteins themselves are being damaged because of some oxidative stress. For other people, it could be a neurological condition that's damaging the nerves. The results kind of end up being the same thing, where you have a strong urgency and maybe some of those other symptoms that we mentioned. So let's just talk a little bit about oxidative stress. And so normal cell works properly if that cell is attacked by free radicals. And this is where we get the concept of antioxidants, things like vitamin C and those sorts of things. If it's attacked by free radicals, those things are oxidants, and those start to damage the cell. And then the cell starts not to work properly. And so what science has kind of shown is oxidative stress can cause damage to DNA, to RNA, to proteins, and to membranes. And really, they think that's the underlying issue for many, many disease states, including this one. There's a lot of research published on this. We also, are calling aging inflammaging because of this oxidative stress. And a good example, something that all of us would be familiar with, is if you left a banana or a strawberry or a tomato out on the counter, and over time that starts to brown up, and that's oxidative stress, and then eventually it starts to shrink down, and it's starting to be consumed or starting to be damaged. What's interesting is, so initially we just thought, okay, all these diseases, all these conditions, it's really just too many free radicals. what we need are a ton of antioxidants. And now we know it's actually kind of a balance. You need to have a balance of some oxidative stress is actually good and healthy for you, and then we need a balance of those antioxidants. I would say for most of us as we age, and then for these conditions, it's too much of the oxidative stress, so we need more of a balance of the antioxidants. So that's the underlying kind of like what's going on below the surface. So let's talk about, well, what can be done. So there's a few different things. I'm going to start with kind of the more conservative things. So bladder training is something that we will talk about. And so what that is you keep a diary. Let's say you're going frequently. I just talked to a gentleman and he said he goes every half hour and every hour, at least 18 times a day while it's daylight. And so he would keep a journal of when he's going, and then he would try and set a clock. Instead of listening just to his bladder to go every 30 minutes, he might set his clock to go off every 45 minutes. And maybe that's on his phone and it makes an alert, and then he goes to the bathroom every 45 minutes. And then maybe after 2 weeks, he changes that to every hour and then keeps doing that process. That's called bladder training. And for some people, that can be an effective mechanism to help kind of calm down those signals that are occurring in the bladder. Another one is physical therapy. Like I mentioned, there was a really great review on the last live that we did where I talked to a pelvic physical therapist. And what was interesting, I thought, is a lot of times we just think about those muscles being really weak. We need to strengthen those pelvic floor muscles, but really it's almost similar to what we just talked about with oxidative stress, where we need to balance. Sometimes people have spasm of those muscles. Sometimes those muscles are soggy and don't work good enough. And we kind of need the spasm to go away, the sogginess to go away, and we kind of need to be in the middle. So pelvic floor therapy can be beneficial for people who are getting this strong urgency. Medications. So I talked about, medications, maybe potentially causing this urgency, but there are medicines that we use to treat overactive bladder and to try and calm down that urgency. I've multiple times mentioned the side effects of those. The older classic medicines actually really increase your risk of dementia, so that's a huge side effect for those medicines. They also increase your risk of falling. The newer medicines don't have that risk, thankfully. Unfortunately, they're not generic, so they end up being expensive. But sometimes those medicines can be effective. It's kind of interesting. I talked to that same gentleman that I was mentioning earlier. He has been taking medicine for nerve pain, gabapentin. But that's actually been shown to help calm down some things in the bladder as well. So there are some medicines that have as a side effect, they will relax the bladder a little bit. Let's talk about supplements. This is something that you guys have heard me talk about before, but essentially almost everyone who has a bladder issue, and really just, adults, should be taking magnesium because most of us are deficient in it. And so generally, most recommendations are somewhere around 400 to 500 milligrams, generally at nighttime. And there has been some research showing that magnesium calms down the bladder from spasm, but also helps the nerves to function properly as well. Vitamin D3, and so just getting out in the sun, I think, is really beneficial for us. But vitamin D is the sunshine vitamin. That's been also shown to calm down inflammation and irritation in the bladder. And then vitamin C, there's research studies on vitamin C helping people with this oxidizing problem. And vitamin C, as you know, is a strong antioxidant. And really what the research has shown is the higher your levels of vitamin C, generally the lower your problem of bladder issues. And so my suspicion is it might be a long-term thing. So like, let's say you have a really bad bladder problem, you just start taking vitamin C. I think it's a good idea. It's not going to hurt anything, but it might not fix the underlying nerves that have likely been damaged over time. So it should not harm anything, but it may not fix it. Now, having I think the opposite of that is, let's say you've been on vitamin C a long, long time and you have high levels, you're maybe less likely to get a bladder problem. So that's probably something that all of us should be on. Well, let's talk about diet. What can we do as far as diet is concerned? Well, it looks like high sugar diets, and that's kind of the Western diet, or high carbohydrate, that can damage nerves. And what we're talking about really is a nerve damage problem. And so oftentimes people are looking at a low carbohydrate diet with natural whole foods. And so what we're talking about is, if you eat vegetables, fruit, or meats, I would say try and eat the healthiest natural ones that you can, and try and avoid processed foods. I've talked about vegetable oils. One of the interesting theories that I've come up with and has been shown in several other diseases like macular degeneration is vegetable oils like canola oil. Those are in all processed foods. Those look like they damage our mitochondria and ultimately lead to more inflammation or more oxidative stress, is another way to say it. Smoking is a classic one of increasing your oxidative stress. So if you smoke and have a bladder problem, if you can stop smoking, that would be great. I would say limiting caffeine, limiting alcohol. And so really our goals for, I think, all of this is to create maybe more of a high oxygen environment. Generally, hypoxia or low oxygen causes more stress on a system, causes more oxidative stress, and a low inflammatory environment as well. And how do we create that higher oxygen environment? Well, one of the things we can do is we can exercise. And so that might be as simple as walking, or it could be more advanced forms of exercise, walking, riding a bike, sauna. If you can't walk, sauna is a really great exercise mimetic. And so those things actually increase oxygen to various tissues in the body. And so we're creating a better oxygen environment with lower inflammation. The final thing I'm going to talk about is actually, the thing that I specialize in. It's called sacral neuromodulation. You guys have heard me talk about this. This is what I'm passionate about. I'm going to just look at the 2-year study that looks at this technology for people with this problem of urgency, and these people also had incontinence. So at 2 years, there was 121 people in this study. 93% of them were responders to this technology. This technology is done in 2 steps. The first step is to see if it works for you. We place 2 little wires just above your tailbone, turn on a little bit of electrical energy, and basically it helps calm down the irritated or damaged nerves, but also helps to augment the normal signal going from your bladder to your brain. So what we like to see is a drastic improvement in your symptoms of urgency, your strong desire to use the bathroom, in your symptoms of incontinence, if you have that, in your symptoms of frequency, and then in your symptoms of nighttime urination. So we track all those things, and we try it out over about 3 days, and you're watching to see how your symptoms respond. So this research study, at 2 years, 93% of people were responders, so it worked for 93% of people. 7% of people it did not work for long term. And those 93% of people, what's considered success in this arena is they had at least a 50% reduction in their urgency and urge incontinence episodes. Now, the average person had a 75% reduction in those things. So that was the average across the study. But we want you, if you're trying it, you need to have at least 50% for us to say that's a success. If after those 3 days you love it, we take the wires out of your body and set you up to implant this little device under your skin. And it's like a little pacemaker for your bladder. It's discreet. No one knows that you have it. But it's always sending that little bit of electrical energy and reconnecting your bladder to your brain. Let's see. Daily urge incontinence episodes decreased from an average of 5.6 per day down to 1 per day at 2 years. So that's a huge improvement for people. They averaged having 5 accidents or a little more than that per day. They went down to one accident. What we see in our practice is oftentimes it's one accident. It's much smaller, or no accidents are obviously what all of us would prefer. 80% of people at baseline had urinary frequency where they were going more than 8 times a day. And that average for the research study, that averaged 11.6 per day. So they were going, fairly frequently throughout the day. That was reduced down to 8.6 per day. And again, 8 or less per day are considered normal. So these people almost went down to normal. Told you, I talked to that gentleman who was going to the bathroom. He said it's been, decades and decades that he's been going at least 18 times a day. Said he doesn't even know what it feels like to feel normal. But what we would do on him is we would try it out, and he would probably go down to this 8 times a day, like I mentioned, and so he would get to experience what normal feels like. And then large leaks in this study at 2 years, so 76 people in this study out of 121 had large leaks coming into the study, and that went down to 1.6 baseline to 0.1. So the large leak people at baseline, they would have 1.6 episode per day of really big, like your full bladder releasing, which is really hard. Even if you have pads or if you have diapers, it's really hard to control all that volume. It went down to 0.1 at 2 years. So that's a massive improvement. 0.1 would mean they had one of these leaks maybe every 10 days. But generally what we see is instead of the large leaks, you have much more control. You're not having those large leaks as much. And then for you guys, for anyone who's interested, the satisfaction rate long-term was at 94%. So 94% of people would recommend this to their family or friends and thought that it made a significant difference in their quality of life. And I'm going to recap real quick here. If you guys have any questions, please drop them in the comments. So we talked about urgency. What is it? Why do we get it? What can be done? And so we talked about why do we get it? Could be damage to those little receptors that are in our bladder. Could also be damage to the nerves that comes from oxidative stress. Also, there's some other disease states that might mimic urgency. There's a lot of medicines that have the side effects of urgency. So it's important to try and tease that out, as well as things like infections. We talked about maybe an anti-inflammatory lifestyle. So bladder training, physical therapy, that's done in the pelvic region, or tightening those muscles, strengthening those muscles. Certain medications might be beneficial for you. Supplements I mentioned that I think could be beneficial for most of us. Magnesium, vitamin D, vitamin C. Talked about a low-carb, anti-inflammatory diet of whole foods, removing vegetable oils, no smoking, and then limiting caffeine and alcohol because those damage the nerves themselves as well. I also talked to you guys about sacral neuromodulation and the 2-year research study. The technology that I use is called Axonics. Right now, it appears to be the leader, has the best research and data. If you are interested in this technology, if you'd like to learn more, we are at bladdercenter.com, and I'd love to talk with you. Thanks so much, and God bless all of you guys, and I hope, I'd love to hear your comments, love to hear any thoughts that you have about urgency, how it affects your quality of life, and how effective this therapy has been for you, or what has been effective for you. Thanks so much.